So, Dr. Sudak, I hope that your brief comments have kind of whetted the appetite of our audience to want to learn some of these high-yield brief techniques, for relaxation, for depression, for all kinds of problems. And I would certainly very highly recommend to them that they read the book you have co-authored, High Yield Cognitive Behavior Therapy for Brief Sessions, to which I will link, and that's the book that I refer to. What would you do? You have any other suggestions for clinicians who would love to continue to learn more about CBT than they did in their training?
Well, sure. Now, people are getting a lot more CBT in training, so that's very helpful. But I do think that there are lots of different ways to access good CBT training. Most, maybe many urban areas have a CBT institute where you can take coursework. There are lots of online trainings available these days. A number of very reputable people do that. The videos and the actual examples and practice exercises in our book, I think, can be really helpful. It does help, certainly, if you want to do CBT in brief sessions. You're a lot better at it if you can do it in longer sessions. In some ways, it's a little bit more challenging to tailor it to the shorter format. So trying to do some longer sessions with CBT, maybe finding a trainer consultant. The Academy of Cognitive Therapy actually has lots of educational offerings and lists people in geographical areas who can provide training and or consultation about CBT. I also think that residency training programs, if you are involved on the faculty in many residencies, if they have a robust CBT training program, at my institution, for example, any faculty member who would want to join the residents and learn CBT would be completely welcome to do that. And I've trained faculty in other institutions that way as well. So there are lots of opportunities out there.
Great. So it's not an all or none phenomenon, but little by little, whatever we can do, we can continue to improve our skills, just like we do for psychopharmacology.
Absolutely.
Thank you so much, Dr. Sudak, for speaking to us.
Thanks for having me.